Good morning, guys. Today I'm deal about bones and joint and muscles injuries. Okay, sorry, this slide is slightly blur. Okay, first I'm going to start with bone injuries. Okay, so fracture and bone broken both. It's a break or crack in a bone. It's called bone injuries. So this is for two categories. Is there closed or open? Closed means the skin is intact. Okay, so upside will be skin is normal, but inside bone will be broke. So first image you can see, okay, that open the skin has been broken. So the second image, okay. So type of fracture. So here five types is there. First, traverse. That one is cut across the bone at right angle. Seen right? The green stick means this one incomplete fracture. Okay, then spiral means usually result from the twisting injuries. Then types of fracture. So this is oblique, communicated and impacted. Oblique is cross the bone in the slanting actions. Then communicated is, see here, communicated. Okay, the bone is fragmented into the more than two pieces. Seen right? Second, impacted. The broken, hence the jumped to the, okay. Then recognize fracture. Recognize means when doubt or treat the injury as a fracture. So many condition we can't to recognize that. So that fracture is recognized fracture. So here dots. So deformity, open wound, tenderness, swelling will be there. So here loss of use, guarding, cryptus, scratching sensation, history. So here cryptus, so that cryptus meanings means cracking sensation, cracking or crunching, cracking. It's between bone and cartilage. Okay, so we can ask to history. Okay, this is signs and symptoms. Then care of fracture. Care of fracture means what will mean? Check the life-threatening condition first. So we can life-threatening means we can divide to the triage. Okay, gently remove the cloth covering to the injury area. Examine the area by looking to feeling dots. Dot means deformity and open the wounds, tenderness and swelling. We can assess mainly that fracture. Okay. So here check the blood flow and nervous using the mnemonic signs. So this is circulation. So for ham injury or field or radial pulse, then leg injury means posterior tibial pulse we can check. Okay. Then fracture sensations. So CMS, right? C means that one. S means sensation. Lightly touch or squeeze one of the victim to toes or finger. Here image you can see movement. Movement means the victim wiggle to toes or fingers. So this is the victim wiggle toe. Then stabilize the injury to the part and open the fracture. Open fracture. Don't push the bones. Okay, so cover the wound with dressing without applying pressure. So open wound we can do like this only. If possible, apply ice packs and seek medical care. Okay, so joint injuries. Joint means here two or more bones come together, that one is joints. Okay, so dislocation everyone know. Okay, one part to lightly uh, dislocated we call dislocation. That dislocation occurs when the joint comes apart and stay apart with the bone ends no longer in contact. Okay, one part to another part is not contact means it will call dislocation. Then recognize dislocation. So this is the symptoms. Okay, deformity, the main sign, severe pain, swelling, inability of the victim to move the injured. Then care of dislocation. Use the rise means rest, ice, compression, elevation. Then use splint or stabilize the joint. Don't try to reduce the joint. Okay, seek medical care. So immediately we can give the medical care. Sprain everyone nowadays, sports or anything, suddenly lift everything we are lifting, the we can seek this one. Okay, the sprain across the when joint twisted or stitched behind its normal range of motion. Okay, the sprain is occurs joint twister or stitched begin is normal range of motion. This is ROM. Okay, so here symptoms: severe pain. Pain prevents the victim from the moving using the joint. So whenever we are moving, will be pain and swelling. Skin around the joint may be discolored. Okay. So here rise procedure. Rise procedure means what I told: ice, compression, elevation, then redness. Okay. So this is the rise procedure. So here we can give apply the ice pack for 20 minutes and apply the compression for the 3 to 4 hours. Repeat the cycle. Rise the injured part. Okay. Use cold chromatic. Then muscle injury. Muscle injury is poses of no real emergencies. Okay. So here strains means also and muscle pull. Okay, strain means muscle pull. Okay, when that is prime, this is strain. Okay, occurs when muscle is stitched begin the normal ROM and TS of the muscles. Inflammation begins immediately after an injury. Can you take 24 to 72 hours of the pain to stiffness of begin? Okay, that strain means sudden or sharp pain affected to muscle, extreme tenderness when touched, then swelling, then weakness and inability to use injury part, stiffness and pain when the victim is move the muscles. After few days, the skin around the injury may be discolored. Okay, then cramps occur when muscle goes to into the uncontrolled spasm. It's contraction. Okay, that associated with the diabetes, atherosclerosis, and physical activities. So here they told for associated with diabetes and the atherosclerosis. Why they telling? So here atherosclerosis means plaque, fatty plaque. It's occur when rupture only we can see this one. Whenever that time it will be happen to that cramps. Okay. So here two categories: the night cramps and occur night rest. Heat cramps mean related to dehydration or electrolyte imbalance. So with this one we are seeing. So symptoms: sudden severe pain usually in the leg, knotting of the muscle and restricted movement. So here what we can give: gently stitch the muscles and relax the muscle. Apply the ice packs, pinch the upper lip hard, and drink lightly salted cold water, and drink a commercial sports drink. Okay. So here muscle condition. Muscle condition means I can show that image. Okay. Hmm. This is the muscle condition. Whenever kids playing, that time it will be happen. This is bruised muscles. Okay. So that time it will be happen. Okay, that muscle condition bruise result from the below the muscles. So example knee is seen, right? So here the swelling, pain and tenderness. After few days the skin the area is maybe discolored. So today we are discussed bone, muscles and joints. Okay, slightly growth all the slides and write exams. Okay, next week I can give them this section giving test. Okay, thank you guys, bye.